Hi, I welcome you all. I am Dr. Sonal from eDentophasia, and here we are again with a new topic to discuss today. First of all, I'd like to extend a warm thanks and so much of gratitude that you all gave so much of love to the last video, which was oral measures to prevent spread of COVID-19. I'm so thankful that you all did give a spread of word and so many messages that came to me that it was so helpful. I'm so thankful from the bottom of my heart. Just keep spreading the love. And let's look at today's topic, which we're going to discuss. Today, I'm going to bust 5 dental myths for you all, which are so popular everywhere in the world. And people think that those are true, but actually we are going to learn about the science and the facts behind them today. So the first dental myth which I'm trying to talk today about is that white teeth are healthy teeth. I've heard everyone who comes to me or who comes to a dental clinic and they come for probably cleaning of their teeth or anything, the first thing they tell is, my teeth are not white, they are not healthy. So let me tell you, white teeth are no measure of a healthy teeth. Health of a teeth depends on the health of the gum, depends on the health of your tongue and oral cavity as a whole, saliva, whether there is presence of plaque or tartar on your teeth, whether there is cavity on your teeth. So health of the teeth is decided by all these parameters, not by the color of the teeth. And nextly I want to tell you is the color of the teeth can alter because of many reasons. If you have had some meal which is a little rich in tinted food like beetroot or something, the teeth might take up stain. Smokers have a typical stain on their teeth, or people who are rich or who take regular beverages like tea and coffee also have stains on their teeth. So there are a lot of reasons because of which a teeth can get stained. Not proper brushing also can be a place where the teeth can get a layer of tartar onto it, and the tartar can start taking the stains from the food, and that is when your teeth can look a little less whiter in the shade. Also, another thing is teeth are never very white in nature. Teeth are usually between white to off-white, and they also depend, the change and the appearance of teeth also depends varying upon the places from where the people belong. So different ethnicities have different kind of tooth color which shows up on their skin. So white tooth are healthy is just a myth. Okay. The second myth which I'm going to bust today is the harder you brush, the better your cleaning of the tooth will be. This is totally wrong. I would like to tell you that you never should do a very hard brushing or very vigorous brushing on your teeth. Why I tell you is, teeth is made up of a substance called as enamel, which is the outermost covering of the tooth, and by nature it has been made the hardest of the things. So it is the hardest substance of the whole human body, but its thickness is very less. It's around 2 to 2.5 millimeters. 1.5 to 2.5 millimeters is the range in which the enamel is there present on the teeth. Millimeters I'm talking. So when you when you brush your tooth very vigorously and with a lot of power, slowly the layer wears off. When it layers off, it exposes the tooth, because of which you can experience sensitivity of the tooth. The tooth might have a little fracture, the tooth might take up stain, cavities can be happening in that area very quickly. Never do hard brushing of the tooth. So brush should be done very gently with a minimum pressure, but effectively and in a proper way with the proper usage of toothpaste for 2 minutes, 2 times a day. That is when effective cleaning of the tooth happens. The third myth which I'm going to bust for you today is that flossing is not necessary. I've heard it from my friends and family also, and from my patients also, and they say that if we are brushing twice daily for 2 minutes and we are gargling well and we are rinsing our mouth with water and we are following everything, then flossing is not necessary, which is very wrong. Flossing is very necessary. I'll tell you why. I have done a little homework for that. So if we see this is what you see when your teeth, you are brushing like this. These are surfaces of the teeth. You brush like this, you brush on their sides, but then there is something here which is left, the surface between the teeth, where the brush can't go. The brush can clean only from up, and the bristles won't be going inside these tight gaps. That is where the food lodgement happens, and sometimes cavities start happening. So what floss does is, the floss travels in between this area and it cleans the food surfaces or any tartar or plaque which is present in that area. flossing, if you do not, it's so important that if you do not do flossing, you are missing out on cleaning 30 to 35% of your tooth portion. So and it's also important basically for the teeth which are behind the molars, because they are bigger teeth, so they have big contact areas which are in touch with each other. So when tartar or plaque is not clean from in between, or there is food substance lying below this contact point, then brush cannot clean it. And if there is something lying there, there are bacteria, ample number of bacteria in our mouth. They can easily sit there, decompose the food, create a lot of acid and cause cavities and gum problems. So flossing is necessary. Never skip flossing also. The fourth myth which I'm going to bust today is that sugars are the only culprits which cause cavities, which is so not true. I'm not saying that sugars do not cause cavities. Sugars do cause cavities, but sugars are not the only things which cause cavities. Anything which has carbohydrate, sugars we say usually, or sweet things, because they are usually sticky in nature, candies or any sticky things we eat, candy floss or the lollipops, all these things are a little sticky and they have those crystallized things which goes and sticks in the crevices of the teeth. Those are the things, because they stick, we usually relate that sweets cause cavities. But even if a piece of rice or a piece of bread or any green vegetable which has carbohydrates into it, it comes and sits there and we don't clean it, it is equally potent of causing cavities. Bacteria do not differentiate between a green vegetable and a sugar. They just need carbohydrate to decompose. They eat their food, they break the carbohydrate, they replicate, and what they do while this whole process is they produce acid which etches our tooth and creates cavity. So sugars are not only to be blamed. So in short, anything which is starchy or has carbohydrates is the culprit, and anything which has starch and carbohydrate and it stays in mouth and we are not able to clean it, or it stays there, is going to cause cavities. Okay, so coming to the fifth and last myth, which is very close to my heart. People say, I've heard everyone saying that milk teeth are not very important. We can avoid the cavities, or we can neglect the cavities of the milk teeth because eventually they are going to fall, which is so not true. I have a specialization in pediatric and preventive dentistry, and I, for matter of sake, know how important milk teeth are. Milk teeth have so many important functions to perform in oral cavity that I'll not be able to list all of them in this video. But to name a few, they help in chewing the food which the child eats. If they have no teeth because of cavity and we don't take care of them and the teeth falls, the child will not be able to eat the food. Child will not be able to break the food properly, because when we chew the food, the digestion starts, and that is how the whole nutritional problem starts occurring. So there are studies where children who have more cavities in their teeth have been associated with having nutritional deficiencies because they are not able to chew. They don't try to eat all the food. It helps in phonics, it helps in the speech of the child. If you don't have teeth, the sound which is coming out of my mouth won't be the same. So if you know how a person without teeth speaks and how a person with teeth speaks, you know what difference I'm talking about. The most important thing is the milk teeth guide the permanent teeth into its place. So when a milk teeth falls, below it comes the permanent teeth. So it guides the permanent teeth. When it falls, it makes the space for the permanent teeth to erupt. So if they fall early, there are a lot of chances that the permanent teeth will go haywire, and that is when you will need a orthodontic treatment or the treatment of braces or Invisalign later in life. Milk teeth are very important. I just can't sum up their importance in the small video section, but I'll urge you all to take and treat milk teeth as equally important as you treat your permanent teeth. It's very necessary that we take care of the milk teeth of children and inculcate this oral hygiene practice right from their childhood so that they don't face problems ahead. There's also a little announcement which I'd like to make. eDentofascia website is going live, so you all can log into www.edentofascia.com. and just a little disclaimer, the site has been made by me. So I'm a dentist, I'm a no techie person. I've tried to make it, and I've tried to make it as smooth as possible for you all. But if at all there are any technical glitches which you feel, or anything which is not happening the way, you can just write us a mail at edentofascia@gmail.com and I'll be happy to help. And please pay us a visit, let us know your feedback, and stay tuned for the next video. The next video is going to be really interesting. It's going to be eye-opening for all of you all. So till then, stay safe, take care, and thank you.